Okay. Okay. We'll just start over.
Okay, good.
Okay, here we go.
All right.
Doug Farmer, the president of the Colorado Healthcare Association, is joining me to talk more about the challenges he is seeing amidst how many centers do you have here again in Colorado, Doug?
We have 206 nursing homes throughout the state of Colorado.
All right. Well, we know that this is particularly a challenge for our older Americans, and that means a lot of restrictions and a lot of changes in those centers. Can you tell me about that?
Yes. So job number one right now is really trying to keep the virus from the door of our nursing homes. You know, we've learned from international and so far what we've been able to glean here in the U.S. Data that the 80 plus population, this virus is particularly lethal. And so job number one needs to be doing everything we can to keep the virus from getting into our care communities. And that's meant a few things. We began last week, really, and in earnest early this week, with some very stringent screening protocols and protocols for deciding who can and cannot come into a nursing home.
And what do those look like? Tell me what those things are.
Yeah, so by and large, the biggest change has really been the number of people that can come into a nursing home. And so that has meant a real restriction around visitors. Which we all understand is unfortunate, but also right now necessary in terms of trying to prevent the spread of COVID. But that has meant a restriction on visitors, a restriction on ancillary workers that might come in and provide different goods and services in a nursing home, and really winnowing it down to those people that need to be in a care community in order to make sure that proper health care is being delivered. And then in terms of screening, there's a set of questions that have come out of our health department that providers ask anyone that once they've decided you can come into the care community, you have to answer a series of questions about your health status, what symptoms you might be experiencing, whether you've been in certain areas that have been, that have been active when it comes to COVID. So once those questions have been answered, then an employee, for instance, could come into the building and get to work.
Let's talk about the seniors. 206 homes. That's thousands of people who live in these places. What's it like for them? I'm sure that there's a certain amount of fear, anxiety that goes along with that. But what's being relayed to them, and what's going through the minds of some of the residents there?
Yeah, it's a great question, and I think it's much like the rest of us right now. There's so much change that's taking place that really most people hadn't stopped to consider how life might change if something like this happened. And I think the same goes for residents of nursing homes. I know that our members have been sending, they sent letters out to not only residents, but family members, friends, community partners, letting them know what they're doing and what's changing in a nursing home and why it's taking place in the interest of protecting these vulnerable residents that we serve. And I think probably the biggest change is just that difference in not having so many visitors coming in. That's something that we generally would be encouraging and pushing and trying to get more groups and volunteers and family and friends to come in and make it truly a home environment for these residents. And in an absence of that, I think, trying to find alternative ways, whether it be, a video chat or just a cell phone call or whatever we can do to get some interaction between these nursing home residents, their friends, their families, just people in the community that want to talk with them.
Yeah. We know that the nursing home in Washington was particularly hit very hard.
Yes.
Any cases that we know of here that you're aware of at your centers?
I am not aware. I'm aware that there are cases. I do not know at this point where they are. And I only have the same access to public information at this point that you might or any other member of the public might. But I'm not aware of exactly what those cases are. I read another news story last night, but I don't know anything more than the general public right now.
And what about the people who work there? I mean, that's a big factor as well, because they, as you mentioned, limiting those people, but coming and going, and their well-being and their state of mind as well. How is that handled?
Yeah, it's challenging. I think they are the front lines of what's happening right now, and trying to make sure that our most vulnerable are being cared for, and also taking care of their own families. When all of this began, obviously there were a lot of changes that took place at a broader societal level, and with the closure of schools, that means that there are many that are having to choose to stay home and care for their children instead of coming to work.
Yeah.
We also know that we are now screening people for those symptoms that I mentioned, and so whenever we find folks that have symptoms or think they might feel symptomatic, they get screened out of the workplace. So that means we're working with relatively fewer people right now,
Yeah.
and so that's a difference.
Yeah. Anything else that you think is important for the public to know about the challenges there from your perspective and all of these senior centers and places that you're working with?
I think the important thing to know is just that the more people follow the public health guidance that's been put out there about social distancing, about staying out of public places if they can help it, about washing their hands, about covering their coughs and sneezes, that's not just important to their families, but it's important to keeping the spread of this virus as slow as possible. And so the fewer number of people that contract the virus in the general public means a relatively lesser exposure to those who are in those age categories and have underlying health conditions that make them particularly vulnerable to the
Yeah.
virus. So
Yeah.
do what you can and try and keep yourself and the rest of society as safe as you can.
Yeah. Well, thanks for your perspective. If anything comes up or any other information that you think is important to get out there that we can help you with, please do so.
Thank you very much for the opportunity to
All
talk.
right. Thank you.
All right.